Well, I'd like to start with kind of how Nashville was in maybe the late 1800s and early 1900s. I think, like many cities across the country, it was a pretty dirty place. We didn't deal well with sewage and chemicals from factories. They were all usually located in very close proximity to where people lived. And we dumped everything in the river or our creeks, and that over time, especially as the city began to grow and there were more people living, obviously those problems led to public health issues, diseases, cholera epidemics, things like that. And so when you look at the history of public health, I think if you really look back to the built environment and how it really started was a response to how can you design a city in a way that starts to address these public health issues. And so things like zoning laws, which were enacted to try to mitigate the problems that arose with having an industry located in the middle of a neighborhood. And that's kind of what led to the idea of the single-use zoning plans and patterns which separated those. So that was a really good thing at the time because it enabled people to not have to live next to a factory where chemicals were pouring out or something. The unintended consequences of that, I think, have, over the last 50 to 60 years, put us in the situation that we are now, where for so many years, especially after World War II, when the country was just expanding with the baby boomers and them having children, there really was a push to get out of cities and to move into the suburbs. And the rise of the automobile and the interstate system, that sort of all led to that and was a very prosperous time in our country and a great expansion. But at the same time, we couldn't necessarily walk to a store and have your food. It was all based on the automobile. So all of these things have kind of led to, I think, a situation that a lot of cities see is there's a lot of suburbanization that does not allow people to get their basic needs without using a car.